Thanks for staying with us. Prostate cancer ranks second in cancer-related deaths among American men, following lung cancer. While it can be a severe illness, the majority of men diagnosed with it do not succumb to it. In fact, over 3.1 million men in the United States who have had prostate cancer remain alive today. What new technologies are currently in use for detecting and preventing prostate cancer? Here to share more is the medical director of Lenox Hill Radiology Medical Imaging Associates, Dr. John Melnick. Doctor, thank you so much for joining us today.
Hi, how are you?
I'm good, thank you. So to start off, prostate cancer is a significant health concern, right? Especially in the United States. So can you provide an overview of what prostate cancer is and its prevalence here in the United States?
Sure. So prostate cancer is a tumor of a gland that sits right below the bladder. The urethra, which carries the urine out of the bladder to the penis, passes through the prostate gland. So it's pretty important because it's a passageway for that urine, and one of the things that happens to most men is that they get an enlarged prostate gland, and the enlarged prostate gland can compress the urethra. So prostate is something that is on many people's minds. As its function, it also contributes to the nutrition of the sperm and the fluid that the sperm sits in, and allows for fertility. So the gland, as we get older, it gets bigger. It's not quite known exactly why the gland gets bigger and why cancers form in the gland, but those processes occur. The average diagnosis is around 66 years old, and it's very infrequent for this to happen before 40. But as we get older, the incidence of both benign prostate hypertrophy and cancer increases. So prostate health is something that's on many men's minds, or should be on our minds, as we get older. In terms of preventing prostate cancer, it's really about early detection. When people talk about eating broccoli, and I certainly try to have my dose of broccoli, but the truth is early detection is what we have been using for many years. Incidence of prostate cancer deaths has declined, and as the diagnosis has increased. The technologies for diagnosing prostate cancer really rely on MRI. PSA is something that's great. It's been discussed, and I think it's been unfairly vilified in that it has sent people on wild goose chases in the past. Early in the 2000s, people thought that PSA was something to be avoided because it could create unnecessary biopsies. Well, MRI has developed over the last 20 years to help to augment a PSA. A PSA is a blood test that people can get that looks for a protein that is presented on the surface of all prostate cells, but is overexpressed in prostate cancer cells. And that protein can be found in blood tests. When it's found, I think that all men should go and get a MRI. The MRI is an excellent tool. If everybody can look at photo 1, it's a picture of an MRI. It's black and white, but as a radiologist, we look for asymmetries. In this picture, you can see this is like if you take the body as a sausage and slice it like this. This is that kind of a slice, and here you can see the bones of the pelvis as well as the prostate gland sitting in the middle of the image. On the side, on photo number 2, you can see the prostate gland sitting right below the bladder. The bladder is the white sac of fluid, and the urethra, which is the conduit of urine, passes through the prostate gland and down through the penis. The prostate gland, you can see on these pictures, is very clear. The PSA is a score, but it allows us to look at the prostate gland and see things like, is it an inflammation that's causing the PSA rise, or is there a true mass? A true mass, when we find it, we can biopsy it. In the old days, in the early 2000s, even if we saw something that was suspicious, we didn't know where it was. When we got MRI, we could figure out where it was, but we couldn't put a needle into it. Now, with new technologies, we're able to fuse these images with a ultrasound biopsy machine that the urologists can use to place the needle directly into the lesion that we are worried about. That's an amazing advantage because we don't have to randomly biopsy the prostate gland. It's those random biopsies that were very concerning for the random PSA scores that were being given to people. The latest technologies are AI, which you see, and this uses a compilation of different MRI techniques and imaging tools to have the computer help us see where the tumors are. This is just another advantage. It takes a good radiologist and makes them better. The AI in combination with being able to place a needle directly into the lesion makes prostate imaging an amazing tool for early detection. What Lenox Hill Radiology is going to be launching soon is a screening program trying to get more men into the machines, imaging, and trying to find these tumors when they're smaller, because smaller tumors are easier to treat. Once a tumor grows out of the prostate gland and metastasizes, it's very hard to treat, and the changes to one's lifestyle are significant. Obviously, it could cause death. Early treatment is a more focal event and can oftentimes prevent this whole process from escalating and causing lifestyle changes.
Yeah, absolutely. And I feel like just in this amount of time alone, I've learned so much. You brought up the AI, which, not too long ago, I actually visited Lenox Hill. We did a story on AI in mammograms for breast cancer detection. So it is great to see how it's expanding and it's taking shape in the medical field. Now, we spoke a lot about early detection and what exactly prostate cancer is. But I do want to ask, what are, some of the key risk factors associated with prostate cancer, and why is it more common in certain demographics?
So I don't think anybody really knows. Black men tend to have a higher incidence of prostate cancer. Prostate cancer has different forms. It's probably different diseases that we all put under the cloak of prostate cancer. There are very slowly growing tumors. There are very rapidly growing tumors. Similarly to breast cancer, there are many forms of breast cancer, and that's part of why it makes chasing down these tumors so difficult. It also is why early detection is so important, because you don't know which of these tumors is going to rapidly grow, expand, get out of the gland, whether it's breast or prostate, and metastasize to the bones or other places. So what we try to do in the medical field is develop technologies, apply technologies, and that's why I'm here, is get the word out on these technologies to encourage people to pursue imaging, pursue the early detection tools that we have, because the trauma to your body and the changes to your body are so much smaller if it's a tiny lesion. Breast, prostate, the same thing. A small surgical intervention is so much easier than all of the other types of cancer treatments available that come afterwards.
Yeah, and we only have about a minute left, but as we wrap up, I want to ask, looking ahead, what do you believe are the most significant challenges and opportunities in prostate cancer detection, prevention, and treatment, especially in the context of emerging technologies and research efforts?
So the real issue here is to get patients involved. We have tools that aren't utilized by the public at large. Some people take advantage of them, and I think they're benefited by them. What we're trying to do is get the message out. The tools exist to dramatically change how we interact and we suffer from prostate cancer. It should be an inconvenience, it shouldn't be life-changing, and it shouldn't be a cause of death.
Absolutely. Doctor, I want to thank you so much for joining us today.
You're welcome. Thank you.
For more information, you can visit their website at radnet.com and call them at 212-772-3111. Don't go anywhere. We'll be back with more Open right after this.